Here are the top 10 worst questions that you need to stop asking when it comes to treatment to help heal your hip arthritis. The quality of the questions you ask will determine the quality of the answers you get. And so if you're asking superficial questions about healing your hip arthritis, then you're going to get superficial answers. That means you get superficial treatment. If you want to get to the root of the problem, then that's a question you should be asking. What is the root cause of hip arthritis? It's not age. It's not a bunch of old injuries that have piled up over the years. It's a muscle imbalance. Once you figure out that it's a muscle imbalance, then you can start to do the right treatment that's really going to fix the root of the problem. Let me tell you what a muscle imbalance is, and then I'll get to all those bad questions that you need to stop asking. When it comes to the hip joint, you have muscles all around. There's muscles on the back called the glutes or the butt muscles, and there's muscles on the front called the hip flexors. This is a real simple explanation. When you get too weak on the back side of the hip joint, the glutes, then the muscles on the front become too strong or dominant to compensate in order to get stability in the joint. When those hip flexors get too strong or dominant, then it pulls the ball forward in the socket and it rubs the joint badly right here. That's what causes arthritis over time, regardless of your age, regardless of old injuries. You can improve this situation nearly every time by getting the glutes stronger. Now, I just explained this to you in a moment. It didn't take long. It's a pretty logical, straightforward explanation. And we've tested this tons of times with patients, with people online, people that have tried our exercises from our YouTube videos, people that are in our hip arthritis recovery program have had tons of success by treatment that follows this approach, this idea of fixing the muscle imbalance. What we have to stop asking, though, are questions like, what's the best exercise for hip arthritis? Because the answers that you'll typically get from that are going to be exercises that involve the muscles in the front of the hip flexor exercises, leg raise exercises. People are going to start telling you need to go walk more, you need to go use a bike more, just exercise in general. They'll say strengthen everything in the hip, but there's no attention paid to the imbalance. And if you just strengthen everything, you're still in an imbalance. If the muscles in the front are this strong and the muscles in the back are this strong or this weak, and you just strengthen everything, you're going to still be in an imbalance, just everything's a little bit stronger. If you strengthen the already strong muscles, then if you're in an imbalance, you're just going to make the situation worse. So it doesn't make sense to ask that question from a healthcare professional that has no understanding on muscle imbalances. Another question you get is, what is the best stretch for hip arthritis? Now, this can make sense at a superficial level because day to day you feel stiffness in your hip joint. And so it makes sense that if I feel stiff and tight, then I need to loosen this up, and a way to do that is stretching. And so in the short term, yeah, that's an okay question to ask, but in the long term, stretching is not going to solve the problem. You can't stretch hip arthritis away. You actually have to strengthen the weak muscle, the glutes usually, and you can strengthen your way into more flexibility. Doesn't make sense right off the bat, but if you fix the imbalance, if you look at it through the eyes of an imbalance, then it does make sense, because when you get those glutes stronger, it pulls the ball into the socket and it creates better mechanics, better movement inside the joint. And so you can get more range of motion and less stiffness inside the hip joint. The third question is walking good for hip arthritis? Now, just about every healthcare professional out there is going to recommend walking. And the reason they do that is because there's actually a decent amount of medical research showing that people that walk tend to feel better if they have hip arthritis and knee arthritis. The problem with this is they don't have in the research a direct cause and effect relationship, meaning they don't know for sure if the walking is truly helping the hip arthritis. And what I can tell you, I see from experience, is what most people go through, and this may be you, is they'll start to walk for exercise and actually feel better. And this is what I think the research is reporting. This is why they're finding this correlation. They'll feel better for a short time, for a few days, maybe a few weeks at most. And if they consistently are walking, what ends up happening is then they start to feel worse. The reason for this is because they have that imbalance. The muscles in the back are weak, muscles on the front are strong. And if you're stronger on the front and weaker in the back, and you go strengthen yourself by walking, get cardiovascular exercise in by walking, move that joint a whole lot when you're walking. At first it feels better just because you probably haven't been doing as much walking. You're outside, you get the air to hit you, the sunlight to hit you, you hear the birds, it just feels good to be out. But then as you strengthen more, and you rub that joint inappropriately, it makes the hip arthritis worse. What needs to happen is fix the imbalance so that the strength is in the right balance. Then walking is a good thing. Then you should go walking for exercise. But until that imbalance is fixed, it's not going to benefit you in the long term. You might get some short-term improvement, but it's actually going to make hip arthritis worse. Number 4 is, what is the best injection for hip arthritis? Not a good question, because it's not solving the muscle imbalance. Whether it's a pain injection or a regenerative medicine injection, I'm talking about like stem cells, PRP injection, or hyaluronic acid injection is another one. All of these injections are putting some chemical, some fluid into your hip joint in hopes of improving the situation, but it's only going to mildly help temporarily. And of course, pain medication, we know that's only going to last so long. With hyaluronic acid, the idea is that you're putting more joint-like fluid into the joint and spacing it out, especially if you're bone-on-bone in your hip joint. If you have bone-on-bone hip arthritis, that's a desirable thing. But if your muscles are pulling that poor hip joint stuck together, you're only going to get a temporary benefit from putting some fluid in there before your muscles overpower it again and pull up. And if you're getting stem cells injected in there with the hopes of developing new cartilage cells to regenerate lost cartilage cells or damaged cartilage cells, but you don't fix the muscle imbalance and the ball is just shoved up into the socket like this, then you're still going to damage those newly formed cells if it works out for you. So these injections are short term as a result. You're asking the wrong question. We need to go back to the root of the problem and get that ball and socket joint offloaded or loaded properly so that you're in the right balance and your hip has a chance to truly heal. Question number 5 is, what's the best medication to take for hip arthritis? I get this question all the time. Should I be taking ibuprofen? Should I be taking naproxen? Should I go to the doctor and get the high power stuff like the horse tranquilizer type stuff? All of these medications don't fix the root problem. You're just looking for short-term relief. And if that's what you're looking for, then great. But what I don't want my patients to think, or people that are trying out our treatment approach to think, is that the medications are going to solve the problem. That doesn't happen. They don't make the weaker muscle stronger. That's the root problem that you need to be very focused on, obsessed even over. Taking a medication is only going to give you relief for a day, if that, maybe a few hours. So don't get focused on which kind of medication to take. You need to not rely on medications. And if you talk to a doctor of medicine, an MD, about this, you'll get caught up in the weeds because that's what they went to school for. Same thing with the injections. That's what they went to school for. They know medications in and out. So they will talk your ear off about it and give you the perception that it's very important because that's what they went to get a doctorate degree for. But it's not going to solve the root problem of your hip arthritis. What they'll do is just offer you another medication. Now try this. Oh, that one didn't work, or you built up a tolerance to that one. Now try this other one. This one has less allergies. This one's new. A drug rep came and sold me on this one, and let's try this new one out. They're going to push medications to you all the time because that's what most doctors studied, and they're trying to help you out. They really are. They're trying to do right by you because that's what they know. That's what they're going to recommend to you. Question number 6 is, what foods make hip arthritis better? I'm not a nutritionist and I'm not a doctor of medicine. I'm a doctor of physical therapy who is a specialist in manual therapy, and I help people avoid surgery. That's my thing. So I can't speak to the specific foods you should and shouldn't eat. What I can say about it, though, is that it's not the main problem for the majority of people. There are absolutely cases out there of people that say, I stopped dairy, I stopped carbs, I gave up gluten, I gave up this or that, tomatoes. There's all kinds of different things out there that people will try, and they have success sometimes. From their perspective, they'll say, my arthritis went away as soon as I gave up these 3 things. Or as soon as I started to add this into my diet, or even a supplement that I can't normally get enough of, now it improved my hip arthritis. What I want to say to that is, I don't think that that's going to be a common thing. That's not going to be something that blanket helps everybody. And I'm not saying it's not beneficial, modifying your diet and adding a supplement in. You could do that. But what I don't think most people out there should be doing is making a diet modification, adding a new food or taking away a food or supplement, and expecting it to solve your hip arthritis problem for the long term. I think you'll get a short-term improvement at best, but we have to remember that this is a mechanical problem. This is a muscle force problem causing bad forces in the hip joints. And supplements and diet modifications just aren't going to make a huge impact on the mechanical aspect of this problem. You have to go do the work to strengthen the weak muscle. Number 7 is, should I use a bike or should I bicycle for exercise? This one comes up all the time because it's such a low impact activity. You know, you're not pounding the floor like you would with walking or anything faster than walking. And it's seen as a very positive exercise for getting lubrication in the joints as well, because you're getting movement in there and circulating the fluid. And overall, the thinking is there, the logic makes sense. The problem I have with it is that most people on a bike are not using their butt muscles. They're not strengthening their glutes. In fact, they're strengthening the hip flexors in the front and the quad muscles in the front of the thigh, which are two muscle groups that make the imbalance worse in the hip joint. And so you may feel better, kind of like with walking, like I said earlier, you may feel better at the beginning when you start to implement a cycling program, if you're cycling for say 20, 30 minutes plus a day, several times a week. But over time, as you get these muscles in the front of the hip and thigh stronger and stronger, it just pulls the ball more forward in the socket, aggravating the joint more and making the hip arthritis worse. What needs to happen is you need to figure out how to use your glutes right in cycling. As you push down on the pedal, you should be tightening the glute on that leg. And then as you circle the pedals around, the other leg has to go down, then the glute on the other side has to tighten up. But this is tricky for a lot of people. Not everybody can do it well. And if you can't do it well, then you shouldn't be cycling for exercise. It's not a blanket exercise that's going to help everyone with hip arthritis. This is why people end up with surgery later on, even though they were on a cycling program for a long time trying to help their hip arthritis heal. And then healthcare professionals out there just chalk it up to age and they say, well, biking's supposed to work, but you know what? You're 72, so you're just too old. You're gonna have to have hip replacement surgery. Might as well get it now before you're too old and the doctor says you can't because now you don't qualify. Number 8 is, what's the best sleeping position to be in? If you have pain at night with hip arthritis, that's one of the worst things because you're losing sleep. Now you can't heal because that's when your body heals the most. And so it's a fight. You're trying to find the right position, and even in once you get into a comfortable position, it begins to hurt after a while. And then you have to switch, and you're playing this game every night of roll over this way, put a pillow there, sit in the recliner, go back to the bed, and then if you sleep with somebody else in the bed, you're waking them up too. So there's another layer added to the frustration of this. The problem that you need to solve is fixing the root problem, because what's happening at night is your hip joint is already just irritated from the day. You've been doing things throughout the day, maybe like cycling, walking, these other exercises that you're inadvertently making your hip arthritis worse with, and it's just angry when you go to bed at night. And so there's no position that's going to be perfect for you. There's some that are just better than others, but for a time. What needs to happen is if you can just get the irritation levels down during the day overall by fixing the root muscle imbalance, then sleeping becomes easier. And then you can sleep in just about any position too, within reason. It doesn't matter if you're on your side, on your back, on your stomach. All those positions should be tolerable for you as long as you're managing your irritation levels by fixing the imbalance. Number 9 is the sitting position. Similar like with sleep, there's no perfect posture. Yeah, there's an ideal, and there's pictures out there of, your feet should be flat on the ground, and if you're at a computer, the monitor should be eye level and your elbows should be support. All these things are the ideal, but even if you're in the ideal perfect posture, like the ergonomic specialists will recommend, you get tired of being in that position. If you have hip arthritis, your hip will start to hurt. There's no perfect chair. You can spend, $1,000 on a chair that's supposed to, and yeah, it'll help. It'll feel better overall, but it's not going to be perfect, and it's not going to solve your hip arthritis problem. Like with sleep, you have to solve the root problem so that your hip isn't irritated and you can tolerate a variety of positions for as long as you want without making your hip worse. Just go solve the root problem. And finally, number 10 is, can surgery fix my hip arthritis problem? Now, theoretically, if you're getting a replacement, a hip joint replacement surgery, they're cutting the bone off right here. They saw it off, and then they cut off the inside of the socket a little bit, they shave it down, and they're putting replacement parts in there. And there's varieties of hip replacement surgeries. There's one called the resurfacing where they only do the ball part of the joint here and then a little bit on the inside. It's less invasive. It's still a joint replacement. They're still cutting parts of your bone off and putting new surfaces on there. All of this stuff is theoretically getting rid of your arthritis because the surfaces of the joint here where the arthritis is visible on the x-ray is gone. And the doctors will even say, you can't even get arthritis again because you have ceramic or artificial parts in there that won't develop arthritis. And so they'll sell it to you this way. And it makes sense. You technically can't get arthritis. But how is it that so many people, after having a hip replacement surgery, still have pain? The reason for that is because they still have the muscle imbalance. They're still weak back here. And they're still dominant and strong in the front. And it's not only the joint that hurts when you have this problem. There's nerves in the area. There's other joints, the SI joint right here, this crack can hurt for some people. There's a ton of other tendons and ligaments in the area that can become affected as a result of the muscle imbalance. But we get so focused in on the joint being the main problem because that's what's visible on the x-ray, and that's what we have a surgery that can be fixed. You can fix it, but it doesn't solve the root problem, and so people still end up with pain later on. And these people will sometimes, it'll be bad enough where they'll go back to the surgeon and they'll say, my hip hurts. What's going on? Can you x-ray it and check it? Then they'll pull up the x-ray and the doctor says, your hip looks fine. Surgery looks great. All the parts are right where they need to be. Nothing's loose. I don't know why your hip hurts. And they leave this poor patient in a position where they don't know what to do next. Can't get another hip replacement if it's all working fine, but I hurt. And so patients just give up and adjust their life to live with pain. They stop doing things that they could before, and they just give up the idea of ever getting back to walking longer and traveling and doing fun things with their family because their hip hurts. When in reality, all that needs to happen is you still need to fix the muscle imbalance. Whether you get a hip replacement or not, fix the muscle imbalance because you're going to benefit either way. Maybe you can avoid the surgery altogether, or if you do have to have the surgery, because there are cases where I'll tell people, yeah, you need a surgery here. But even if you have the surgery, you're still going to have the imbalance afterwards because the surgery doesn't fix the imbalance. It just replaces the surfaces of the joint. You still have things pulling badly around your hip, and you can still get pain for other reasons. This is why these are bad questions to ask. They don't solve the root problem. None of these questions are considering the root problem. And that's the one that you need to be asking is how do we fix the root problem of hip arthritis? Once you start asking that question, then you'll start finding the right answers. Hey, if you want to get more details on our treatment approach to fix the hip arthritis problem, check out this video here about our hip arthritis recovery program.